Namaskar, Dr. Priyanka.
Namaste.
Uh, as I explained to you before, that we have been interacting with various medical experts to bring the
Mm.
awareness and education among laymen like us who do not have
Right.
much idea about diseases and treatment course and symptoms and things related to it. Suddenly, when the
Mhm.
panic attacks, we find it really challenging to face the situation, and then we blame everything possible if things don't go our way. So,
Correct.
from that point of view, I have been talking to various doctors, and internal medicine is another very important area in the medical stream, which people are not much aware of, and also how it is useful for them not only to prevent the risk but also to manage the long term challenges if at all they have some acute or challenging diseases. And how does that help?
Right.
All that we are going to talk to you today. So, thank you
Okay.
so much once again for your time.
My pleasure.
So, Doctor, very basic question I have. Uh, you have been practicing for more than, let's say, 15 years now, and current role is full-time consultant internal medicine for the prestigious brand in Mumbai.
Right.
What I want to understand is what is the difference between general practitioner and the internal medicine doctor?
So, to begin with a very bare basic technicality, an internal medicine doctor is a specialist
Mm,
who has studied for 3 more years beyond their MBBS.
okay.
And a general practitioner, basically MBBS or the other allied branches,
Yeah.
are somebody who have not done their post graduation.
Okay.
So that is the bare basic technicality.
Mm,
Apart from that, the area of practice
mm,
differs. So a general practitioner is basically a family doctor.
mm,
They treat everyone, right from children
mm,
to old age,
mm,
whereas an internist is essentially a doctor for adults.
mm,
Now we have also started treating adolescents because with the current situation,
mm, mm.
adolescents body composition is nearly equivalent to an adult. And so adolescents are not necessarily treated by pediatricians anymore, but they are treated by internists. But essentially, internists are doctors for adults. Apart from
I
that,
see.
general practitioners have a scope of practice which includes comprehensive care, which
Mm,
might be basic regular checkups
mm,
or treating acute fevers and acute
mm,
uncomplicated
mm,
illnesses,
mm.
treating injuries,
Okay.
tending to injuries,
Mm,
dressings, regular
mm,
dressings,
mm,
administering painkiller injections or
mm,
vaccinations.
mm.
Whereas an internist's practice is more related to the more complex part of medicine. So it is diseases, chronic diseases, and acute diseases which involve internal organs.
Right. So, by and large, if I understand it clearly, general practitioner is for our general health issues, including the
Yes,
infants and other family members. However,
yes.
internal practitioner or internal medicine person is something who would address or treat our acute or very specific
More
disease areas.
complicated
Yeah, more
diseases.
complicated one, and especially for the adolescent and beyond that.
Yes.
Got it. Thank you. So, Doctor, if you can explain more about what is the scope of the internist when we call it?
So the scope of an internist is based on OPD practice.
Mm,
It is diagnosis and treatment of acute and
mm,
chronic illnesses.
mm,
It is regular screening of health issues
mm.
for people who have chronic diseases. An internist has to keep an eye at the onset of complications
Okay.
so that they don't go ahead further and become advanced disease.
Okay. So, what
All
is what
from
adding to this? What is your how do you manage this when let's say you have a couple of cases with you who are having a
Hmm,
acute or chronic diseases, and then
hmm.
you are monitoring them. Now, what is your approach when you say that you have such kind of person?
So internal medicine, if you see the other specialties, internal medicine can be called the detectives of medicine.
Hmm.
So for an internist, the scope of practice begins with a detailed history
Hmm.
or detailed physical examination,
Hmm. Hmm.
the duration of the history,
Hmm.
whether the onset is sudden or it has been occurring in episodes. It might
Okay.
be sudden once,
Yeah. Yeah.
but that person might have had those sudden episodes multiple times.
Hmm.
and they might have ignored them. Whether that sort of a history, if there is a family history to find out any genetic predisposition, if it is a drug induced complication, that needs to be found out by the internal medicine doctor. So basically, everything lies in the history and physical examination. The lab investigations and the radiology comes secondary. That is just to confirm the diagnosis.
Got it. Got it. Yeah. Doctor, now during my discussion with various experts, four major areas which are like very common, whether rural or urban, it is across the nation we are talking about. Alcohol consumption, smoking, then stress because it comes with mental health, we can call it, and as well as the lack of exercise and not following the diet pattern. These are major challenges that is causing some or the other health issue. So,
Correct.
do you also have that as part of your treatment when any particular patient approaches you?
Yes, of course. So preventive medicine is pretty much an integral part of internal medicine. So along with that, counseling on nutritional aspects and lifestyle modification, de-addiction, if needed, of course, we refer it further to a psychiatrist. But basic de-addiction, medications to keep the withdrawal symptoms under control, diagnosing whether the person is dependent on those, all that is a part of our practice.
So, angionerve diseases, hypertension, diabetes, whatever. Other than these general suggestions or advices that you give, how can somebody avoid, or if at all they get it, what will be your suggestion to them, how to manage it, other than the medicines?
So medicines is the secondary part. The treatment of all these diseases begins at home to begin with, to begin in the kitchen. So the major part of internal medicine is lifestyle changes. So changes in dietary patterns, educating the patient more on what are the hidden sources, what are the hidden culprits. Many Indians are under the misconception that their sugar will increase only if they eat sugar. They don't know that the jaggery that they eat will also contribute. So a lot of diabetics actually eat jaggery as a substitute for sugar, thinking it is not going to. A lot of them eat a lot of glucose biscuits, thinking they are healthy. There is a big misconception that fruit juices are healthy. So all this, it is a gradual process because it has been ingrained in our minds for centuries now. So that needs to be gradually changed to a more clean eating approach amongst Indians.
Another theory that is very popular nowadays, it is called fasting. And how much do you recommend it, and how much do you think it is really useful?
So yes, fasting has been proven to cut down to de-age the cells. It slows down the aging process. To some extent, it also slows down the advancement of cancer or prevents it. But then it depends from person to person what kind of fast they are doing, whether they have diabetes and other issues, whether they have acidity issues. People who have acidity issues cannot go on a prolonged fast. Whether they have any other electrolyte imbalances. People with migraine issues cannot fast for very long. So that depends from person to person. It is not one approach to all. It is a very customized thing based on that patient.
Okay, the reason I'm asking is almost every second person is promoting fasting and under various names like intermittent fasting, 72 hours fasting, and they are claiming that it will take care of everything. Your acidity also will be taken care.
It doesn't take care of everything. Traditionally, also that way people were supposed to finish eating before sunset. So, and that is a healthy practice because your digestion tends to slow down with time. So, if somebody who eats very late, you will always find that they have digestive issues, they have
acidity issues,
they have difficulty managing their sugars. So, your circadian rhythm based fasting is definitely recommended. So, finishing your last meal of the day, as if not before sunset, may not be possible with work and everything, but as early as possible. So that is definitely recommended. We need not call it a fast, just a more circadian rhythm based eating.
Some sort of a scheduling timetable which can be followed. Yeah, makes sense. Makes
So, like I said, general physician can handle what is uncomplicated.
correct.
Fever which has a history of 2-3 days.
Yes.
But when it goes beyond that, when there is a possibility that there is a pneumonia underlying which might go missing, which might be missed out by the general practitioner. In India, antibiotic misuse also happens largely because modern medicine is practiced even by people who don't study modern medicine. That is one of the reasons. So those patients might need to see an internal medicine doctor. People with chronic illnesses, of course, diabetes, hypertension, cholesterol, thyroid issues, they need their periodic checkups and modifying their medications. Or those who have diseases pertaining to various systems. They have one prescription from the neurologist, one prescription from the cardiologist, one prescription from the ortho. Sometimes there are drug interactions which might get missed out by their GP. If they go to the GP for a regular follow-up, saying they don't want to go to those 3 or 4 doctors, that might get missed out by the GP. So they need to see an internal medicine doctor for a comprehensive prescription of all specialties together.
Autoimmune people are also coming large numbers.
Autoimmunity is another issue altogether. So autoimmunity is when your own body makes immunity against
More
your
antibodies,
own
yeah.
body. Yeah. The autoantibodies they are called. So this again has multiple factors. There might be family history of autoimmune issues, but stress and inflammation are the major contributors to autoimmune illnesses. So this inflammation may be because of food, excessive intake of foods which do not suit. We stick to traditional meals. We don't think whether this is suiting me or this is not suiting me. But you have to keep a fine eye on how your body reacts to a certain meal. Your skin might face changes with milk products, or you might feel bloated when you eat wheat products, or certain types of dal may not suit you.
Correct.
Plus chemicals in food, microplastics, another component which is there in a part of our lives.
Correct.
That again might contribute to more cases of autoimmunity. Plus more diagnosis. Earlier also people might have had those symptoms, but they might have attributed it to something else without going deep into search. Yeah. So more diagnosis, more cases being diagnosed is also the reason why we know more about autoimmune issues.
Acha, doctor.
Initially, might have been there, but they were never diagnosed.
Okay. Acha, addition to this, because why am I asking? Inflammation is another area that has been discussed a lot nowadays, which was not known before. But my question or doubt is, women in menopause stage or post menopause are more prone for the inflammation situation.
Not this post menopause. Right, for young age women are more prone. It is because of their hormones.
Because of their hormones. Okay. So when we say inflammation, what all it covers? What all happens rather?
So it might be generalized. Somebody might have joint pains. Somebody might have skin issues. Things like endometriosis might happen because of that inflammation. Gut issues. A lot of people will say, I have IBS. So that also might be a part of inflammation. Indigestion can be a part of frequent headaches, difficulty, aches and pains in muscles and joints. Things like fibromyalgia, which as such have no particular cause, but it might just be inflammation.
Post-menopause women tend to put on weight and there is more bloating in the body. Is it true? And if so, what can be the solution for it?
So to some extent, yes, because like I said, the metabolism tends to slow down once the estrogen levels in your body go low. Apart from that, the muscle tone starts going down, but the body fat remains loyal. So your hips start widening and your abdomen starts widening, but your arms and legs start becoming thinner and thinner. Because the muscles, if you see most post-menopause women have very narrow shoulders, they have bad postures.
Yes.
So they have to have adequate protein in their meal, adequate good fats in their meal to prevent that muscle loss. plus muscle strengthening exercises, plus their dietary supplements should be good.
Do you suggest to avoid any kind of food for such cases? Of course, the dietary suggestions are there, definitely, that less low fat and not fried and etc. etc.
There is nothing that needs to be avoided completely.
Mhm.
It depends on how much they are eating.
There
So
it is.
refined carbohydrates, saturated fats need to be less.
Mhm.
And more of complex carbohydrates, more protein and more good fats, more omega-3 fats.
There are people who also suggest or rather adopt hormone replacement therapy. What is it and how much it is advisable?
So it is not a very commonly used modality in India so far,
Mhm.
but it is a good option,
Mm.
especially for women who have hit their menopause early,
Mm.
in their early 40s or even in late 30s. Nowadays, many women undergo menopause. So especially for them, to prolong the good effects of hormones on their bones and their heart and their hair and skin, because finally it is their self-respect which
True,
takes a
true,
hit.
true, true.
The hair starts falling
Falling,
and
yes,
turns
yes,
grey,
turning gray, yeah.
and then when their skin starts feeling dry, wrinkled.
Mm.
So for such women especially who have had early menopause,
Mhm.
definitely hormone replacement therapy should be uh, there on their treatment plan.
Mhm.
The menopause is not very early, 45 to 50 years of age. Still, it is not a bad treatment modality.
Mm.
It is just that a detailed assessment needs to be done if they have any risk of any form of cancers, breast cancer, ovarian cancer, etc. After a detailed screening, they can be put on it.
So, doctor, I think from my primary questionnaire, I have asked you almost everything. Anything that you want to suggest as a final advice?
So, as a final advice, I would just say, depending on your health condition, routine health screening is very important for everyone.
Yes.
So it is better, at least even if you don't have any health conditions,
Mm.
it is important to meet an internal medicine physician once a year with that screening report.
Mm.
So as to not miss out any mild findings which might get or warning signs which might get missed out. For chronic diseases, of course, from time to time, a periodic follow up with an internal medicine physician is necessary. Infectious diseases, like I said, whenever there is even a likelihood that there might be antibiotic resistance,
Yes.
that it is going to get complicated,
Yes.
it has to be, the treatment has to be from an internal medicine doctor. If any referrals are to be given, the best person is an internal medicine doctor to know whom to refer to, whether it is
Correct.
going to be a neurologist or a rheumatologist,
Yes.
because sometimes
Yes.
people don't know.
Yes.
They have pain somewhere, they don't know that a
True,
ortho should
true.
see it, or a neuro should see it, or a rheumatologist should
Absolutely,
see it.
absolutely.
The basic set of investigations has to be advised by an internal medicine doctor.
Great.
So Indians still have a lot of confusion about that, I think.
Yes.
So we need to be more aware about that.
Absolutely, absolutely. Yeah, whom to go first is always a doubt. Like,
Yes.
then the proper direction and guidance can be opted. Absolutely. Thank you very much for your time, and that's all we had.